So this is the CAT study. It's the COVID anti-CD14 treatment trial. And this is a study looking at whether an antibody against CD14, a protein found on immune cells, will reduce inflammation in COVID-19 pneumonia and reduce the time to improvement and discharge in those patients. We hope that this antibody will dampen inflammation, reduce inflammation in patients with severe COVID-19 pneumonia, people who have a need for extra oxygen, so their oxygen levels are low. We're hoping that this antibody will block the amount of inflammation and hasten the improvement to where people are able to get off of extra oxygen and we hope get out of the hospital sooner. The drug was actually used several years ago in a trial here at Harborview in patients with severe lung injury, acute respiratory distress syndrome, ARDS. And so we gave it to those patients or a placebo and found that people who got the IC14 drug had reduced inflammation relative to the placebo. And so that was part of the basis for trying it in this situation. We don't have evidence in COVID pneumonia, but many of the processes that are at play in ARDS, we think are involved in development of severe pneumonia in COVID, and that's the reason why we decided to try this in COVID-19. Back last spring, when things really became severe, we all felt a lot of dismay about the lack of treatments for this really horrible illness. Since then, we've had remdesivir approved and are now using dexamethasone. So we have two reasonably good therapies, but in spite of that, and over the last couple of weeks, we've seen a surge in patients who are still getting very, very ill in spite of these therapies, some of whom die. And so I think we're back to feeling like we really need additional therapies to help prevent this. So we're hopeful that anti-CD14 might be something that can offer help for those people. We are actively searching for patients to be in the trial every day here at Harborview, and then when it gets up and running at UW-MC, we'll do the same. So I'm pretty confident that we'll find anybody who might qualify, but we're also educating providers here at Harborview, and we'll do the same at Montlake. So certainly if they've heard about this trial and have a loved one who's admitted to one of these hospitals, certainly they should talk to the physicians taking care of them and see if they can get in contact with us.